Question 1. The review process indicates that a patient presents with symptomatic osteoarthritis of the ankle, for which conservative management has failed. The physician, who has extensive experience and a high volume of cases involving a specific type of ankle arthrodesis, is considering recommending this procedure. However, the physician is also aware of other surgical options, such as ankle arthroplasty and non-surgical interventions that might be considered. The physician must decide how to present these options to the patient to ensure informed consent and adherence to ethical practice. Option A. Recommend ankle arthroplasty as the primary surgical option, highlighting its joint-preserving nature, while presenting ankle arthrodesis as a more aggressive procedure with significant functional limitations, and suggesting that non-surgical options are unlikely to provide significant relief given the patient's current symptoms. Option B. Present ankle arthrodesis as the most definitive and recommended solution, detailing its benefits and risks, while briefly mentioning ankle arthroplasty as an alternative with a higher revision rate, and downplaying the potential benefits of non-surgical options due to their limited long-term efficacy in this patient-specific presentation. Option C. Discuss ankle arthrodesis, ankle arthroplasty, and the potential for continued conservative management, providing a balanced overview of the risks, benefits, and expected outcomes for each option, and actively engaging the patient in a discussion about their preferences and goals. Option D. Focus solely on the surgical options, presenting both ankle arthrodesis and ankle arthroplasty with equal detail, but omit discussion of non-surgical management, as the patient has already failed conservative treatment and surgery is now indicated. The correct answer is B. Present ankle arthrodesis as the most definitive and recommended solution, detailing its benefits and risks, while briefly mentioning ankle arthroplasty as an alternative with a higher revision rate, and downplaying the potential benefits of non-surgical options due to their limited long-term efficacy in this patient-specific presentation. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to provide accurate and unbiased information to patients regarding treatment options, while also navigating the complexities of potential conflicts of interest and the physician's own experience and biases. The physician must balance the patient's autonomy in decision-making with the responsibility to offer evidence-based and appropriate care. The core of the challenge lies in ensuring the patient receives a comprehensive understanding of all viable treatment pathways, including those that may not align with the physician's personal preference or immediate financial interests. The correct approach involves a thorough and objective discussion of all medically indicated treatment options for the patient's osteoarthritis, irrespective of the physician's personal experience or the perceived complexity of alternative surgical procedures. This includes clearly outlining the risks, benefits, and expected outcomes of each option, as well as the potential for non-surgical management. This approach aligns with the ethical principles of patient autonomy and beneficence, as mandated by professional standards and the American Board of Foot and Ankle Surgery's commitment to patient-centered care. Specifically, the ABFAS emphasizes the importance of informed consent, which requires physicians to present all reasonable treatment alternatives. Failure to do so can be considered a breach of professional duty and may have legal and ethical ramifications. An incorrect approach would be to unduly influence the patient's decision by emphasizing only the surgical option the physician is most comfortable performing, while downplaying or omitting other valid treatment modalities. This could be seen as a violation of the principle of informed consent, as the patient is not being presented with a complete picture of their choices. Furthermore, if the physician has a financial interest in a particular surgical device or hospital, failing to disclose this potential conflict of interest and allowing it to sway treatment recommendations would be a significant ethical breach, potentially violating guidelines related to physician self-referral and conflicts of interest. Another incorrect approach would be to dismiss the patient's concerns or questions about non-surgical options, thereby limiting their ability to make a fully informed decision. This demonstrates a lack of respect for patient autonomy and a failure to engage in a collaborative decision-making process. Professional decision-making in such situations requires a commitment to patient advocacy, a thorough understanding of current medical literature and treatment guidelines, and a transparent approach to discussing all available options. Physicians should actively solicit patient preferences and values and engage in shared decision-making, ensuring the patient feels empowered and informed. Regular self-reflection on personal biases and potential conflicts of interest is also crucial to maintaining objectivity and upholding the highest ethical standards. Question 2. Operational review demonstrates a patient presenting with chronic ankle instability following multiple traumatic events. The surgeon is tasked with developing a comprehensive treatment plan. Which of the following diagnostic and management approaches best reflects the detailed knowledge of ligamentous anatomy and its role in stability required for the American Board of Foot and Ankle Surgery Certification Examination? Option A. Recommending immediate arthroscopic evaluation to identify any intra-articular pathology, with a secondary consideration for ligamentous stability. Option B. Focusing solely on palpating for tenderness over the lateral malleolus and proceeding with surgical reconstruction of the lateral collateral ligaments without further detailed anatomical evaluation. Option C. A thorough physical examination to assess the integrity of the anterior talofibular ligament, calcaneofibular ligament, posterior talofibular ligament, deltoid ligament, and spring ligament complex, correlating findings with the patient's reported functional deficits and mechanism of injury, followed by targeted imaging and a treatment plan addressing all identified ligamentous injuries. Option D. A general assessment of ankle swelling and tenderness, assuming a common lateral ankle sprain, and initiating a standard rehabilitation protocol. The correct answer is C. A thorough physical examination to assess the integrity of the anterior talofibular ligament, calcaneofibular ligament, posterior talofibular ligament, deltoid ligament, and spring ligament complex, correlating findings with the patient's reported functional deficits and mechanism of injury, followed by targeted imaging and a treatment plan addressing all identified ligamentous injuries. Explanation. This scenario presents a professional challenge due to the inherent complexity of diagnosing and managing ankle instability, which directly impacts patient function and requires a thorough understanding of intricate ligamentous anatomy. The challenge lies in accurately identifying the specific ligamentous structures involved and their contribution to the overall stability of the ankle joint, necessitating a high degree of diagnostic acumen and surgical planning. The American Board of Foot and Ankle Surgery Certification Examination emphasizes this knowledge to ensure practitioners can provide safe and effective patient care. The correct approach involves a systematic evaluation that prioritizes the identification of the specific injured ligamentous structures and their functional implications. This aligns with the core competencies expected of a certified foot and ankle surgeon, who must possess detailed knowledge of the deltoid ligament, lateral collateral ligaments, anterior talofibular, calcaneofibular, posterior talofibular, spring ligament complex, and interosseous ligaments. Understanding their roles in maintaining ankle stability during various biomechanical stresses is paramount for accurate diagnosis, appropriate non-operative management, and precise surgical reconstruction. This detailed anatomical and functional understanding is a fundamental requirement for board certification, ensuring the surgeon can develop a treatment plan that addresses the root cause of instability and restores optimal function. An incorrect approach that focuses solely on generalized ankle swelling without specific anatomical correlation fails to meet the diagnostic standards required. This superficial assessment neglects the critical need to pinpoint the injured structures, leading to potentially inadequate or misdirected treatment. Ethically and regulatorily, this approach falls short as it does not demonstrate the required depth of knowledge and clinical reasoning expected of a board-certified surgeon, potentially jeopardizing patient outcomes. Another incorrect approach that relies on a broad assumption of lateral ligamentous injury without detailed assessment of the deltoid or spring ligament complex is also professionally unacceptable. While lateral ankle sprains are common, overlooking other potential contributors to instability, such as a deltoid ligament rupture or spring ligament insufficiency, can lead to incomplete diagnosis and treatment. This demonstrates a lack of comprehensive anatomical understanding and a failure to consider the entire spectrum of ankle stabilizers, which is a direct violation of the expected standard of care and the knowledge base assessed by the certification examination. A third incorrect approach that prioritizes immediate surgical intervention without a thorough preoperative assessment of ligamentous integrity and functional deficits is also flawed. While surgical intervention may be necessary, it must be guided by a precise diagnosis derived from a detailed understanding of the injured anatomy and its functional consequences. Proceeding surgically without this foundational knowledge risks performing an inappropriate procedure, potentially exacerbating the problem, or failing to address the primary source of instability. This reflects a failure in professional judgment and a disregard for the systematic diagnostic process essential for effective foot and ankle surgery. The professional reasoning process for similar situations should involve a structured approach. First, a comprehensive history and physical examination focusing on the mechanism of injury, pain location, and functional limitations. Second, detailed palpation to identify specific areas of tenderness correlating with anatomical ligamentous structures. Third, appropriate imaging, e.g., MRI, stress radiography, to confirm ligamentous integrity and extent of injury. And finally, a treatment plan tailored to the specific ligamentous injury and its impact on ankle stability and function, always referencing established anatomical principles and clinical guidelines. Question 3. Assessment of a patient's complex foot deformity and suspected bony injury reveals a CT scan with multiple views. Which of the following interpretive approaches best demonstrates adherence to the rigorous standards required for accurate diagnosis and surgical planning in foot and ankle surgery? Option A. A primary focus on the axial views, as these typically provide the most direct visualization of the bone shafts, with less emphasis on other planes unless a gross abnormality is immediately apparent. Option B. An interpretation that prioritizes identifying large, displaced fractures, while considering smaller fragments or subtle articular step-offs as less critical unless they are overtly symptomatic on initial review. Option C. An assessment of the CT scan findings solely based on the radiographic images, without significant integration of the patient's subjective complaints, mechanism of injury, or physical examination findings. Option D. A comprehensive review of axial, sagittal, and coronal multiplanar reconstructions, along with 3D renderings, to meticulously evaluate all bony structures, articular surfaces, and the overall three-dimensional integrity of the foot and ankle, correlating these findings with the patient's clinical presentation. The correct answer is D. A comprehensive review of axial, sagittal, and coronal multiplanar reconstructions, along with 3D renderings, to meticulously evaluate all bony structures, articular surfaces, and the overall three-dimensional integrity of the foot and ankle, correlating these findings with the patient's clinical presentation. Explanation. The scenario presents a common challenge in foot and ankle surgery, interpreting complex CT scans for bony injuries and deformities. The professional challenge lies in accurately identifying subtle fractures, assessing the extent of comminution, evaluating joint congruity, and understanding the three-dimensional nature of deformities, all of which directly impact surgical planning and patient outcomes. Failure to do so can lead to misdiagnosis, inappropriate treatment, and potentially suboptimal or harmful results, raising ethical concerns regarding patient safety and competence. The correct approach involves a systematic and comprehensive review of the CT scan, utilizing multiplanar reconstructions, axial, sagittal, coronal, and 3D renderings to fully appreciate the bony anatomy and pathology. This includes meticulously examining each bone, joint, and articular surface for evidence of fracture, displacement, malunion, or degenerative changes. The surgeon must correlate these findings with the patient's clinical presentation and radiographic history. This methodical interpretation aligns with the ethical obligation to provide competent care, as mandated by professional standards and the American Board of Foot and Ankle Surgery, ABFAS, certification requirements, which emphasize the surgeon's responsibility for accurate diagnosis and treatment planning based on thorough evaluation of diagnostic imaging. An incorrect approach of relying solely on axial views would be a significant regulatory and ethical failure. This overlooks the crucial information provided by sagittal and coronal reconstructions, which are essential for assessing fracture displacement, joint alignment, and the true extent of deformities in 3 dimensions. Such a limited review demonstrates a lack of due diligence and a failure to utilize all available diagnostic information, potentially leading to misinterpretation and inadequate surgical planning, violating the principle of providing care commensurate with the surgeon's training and expertise. Another incorrect approach of focusing only on obvious gross fractures while ignoring subtle articular step-offs or small avulsion fragments would also be professionally unacceptable. This demonstrates a failure to appreciate the nuances of bony injuries, particularly in complex deformities or post-traumatic situations. Such an oversight can lead to overlooking critical elements that, while seemingly minor, can significantly affect joint function and long-term outcomes, thereby failing to meet the standard of care expected of a certified foot and ankle surgeon. A third incorrect approach of interpreting the CT scan in isolation without correlating findings with the patient's clinical history and physical examination is also a critical failure. While CT provides detailed bony information, it must be integrated with the patient's symptoms, mechanism of injury, and physical findings to form a complete diagnostic picture. Ignoring the clinical context can lead to misinterpretation of incidental findings or failure to recognize the significance of subtle radiographic abnormalities in the presence of specific symptoms, thus compromising the diagnostic process and patient care. The professional decision-making process for interpreting complex CT scans should involve a structured approach. 1. Understand the clinical question and patient history. 2. Systematically review all available imaging planes, axial, sagittal, coronal, and 3D reconstructions. 3. Identify and characterize all bony abnormalities, including fractures, displacement, comminution, and joint involvement. 4. Assess the extent and nature of any deformities. 5. Correlate imaging findings with the clinical presentation. 6. Formulate a differential diagnosis and a definitive diagnosis. 7. Develop a comprehensive treatment plan based on the integrated assessment. This systematic process ensures thoroughness, accuracy, and adherence to professional standards of care. Question 4. Upon reviewing the ultrasound images of a patient presenting with chronic plantar heel pain, you observe a thickened plantar fascia with some hypoechoic areas, but no clear evidence of a tear. The patient's pain is exacerbated by weight bearing and improves with rest. Considering the diagnostic information and the patient's symptoms, which of the following represents the most appropriate next step in management? Option A. Proceed with an ultrasound-guided corticosteroid injection into the plantar fascia at the site of maximal thickening. Option B. Perform a diagnostic aspiration of the hypoechoic areas to rule out infection or inflammatory arthropathy. Option C. Recommend a trial of conservative management including stretching exercises and orthotics, and schedule a follow-up ultrasound in 6 weeks. Option D. Refer the patient for surgical consultation for plantar fascia release based on the ultrasound findings. Correct answer is A. Proceed with an ultrasound-guided corticosteroid injection into the plantar fascia at the site of maximal thickening. Explanation. This scenario presents a common challenge in foot and ankle surgery, integrating advanced diagnostic imaging with therapeutic interventions, specifically concerning the interpretation of ultrasound findings and the subsequent decision-making for guided injections. The professional challenge lies in accurately interpreting subtle ultrasound findings, correlating them with the patient's clinical presentation, and then applying this interpretation to a therapeutic decision that adheres to established standards of care and ethical practice within the scope of foot and ankle surgery certification. Misinterpretation or an inappropriate application of diagnostic information can lead to suboptimal patient outcomes, unnecessary procedures, or even iatrogenic injury. The correct approach involves a comprehensive interpretation of the ultrasound, considering not only the presence of abnormalities, but also their characteristics e.g. size, echogenicity, vascularity, and their relationship to surrounding structures. This interpretation must then be synthesized with the patient's history, physical examination findings, and the established indications for ultrasound-guided injection for the suspected soft tissue injury. Adherence to the American Board of Foot and Ankle Surgery, ABFAS certification standards implies a commitment to evidence-based practice and patient safety. Therefore, utilizing ultrasound to confirm the diagnosis of a specific soft tissue injury, such as tendinopathy or a bursitis, and then proceeding with an ultrasound-guided injection when clinically indicated, represents the highest standard of care. This approach ensures that the intervention is precisely targeted, potentially increasing efficacy and minimizing risks, and is supported by diagnostic certainty derived from the imaging modality. An incorrect approach would be to proceed with an injection based solely on a presumptive diagnosis, without a clear ultrasound confirmation of the specific soft tissue pathology. This bypasses the diagnostic utility of the ultrasound, potentially leading to injecting into an incorrect anatomical location or treating a condition that does not warrant injection, thereby failing to meet the standard of care expected of a certified foot an ankle surgeon. Another incorrect approach would be to interpret the ultrasound findings in isolation, without correlating them with the patient's clinical presentation. This can lead to overdiagnosis or underdiagnosis, resulting in inappropriate treatment decisions. For instance, identifying a minor anatomical variant on ultrasound and treating it as a pathological condition requiring injection would be an ethical and professional failure. Finally, relying on another practitioner's interpretation of the ultrasound without independent review and clinical correlation, especially when making a therapeutic decision, would also be professionally unsound, as the treating surgeon bears the ultimate responsibility for the patient's care and the diagnostic information used to guide it. The professional decision-making process in such situations should involve a systematic evaluation. 1. Thorough patient history and physical examination to establish a differential diagnosis. 2. Performance or review of diagnostic imaging, in this case, ultrasound to confirm or refute specific diagnoses. 3. Critical interpretation of imaging findings in the context of the clinical picture. 4. Consideration of established treatment algorithms and indications for interventions like ultrasound-guided injections. 5. Patient consultation regarding risks, benefits, and alternatives. 6. Precise execution of the chosen intervention, utilizing imaging guidance when appropriate for accuracy and safety. Question 5. Stakeholder feedback indicates that a significant number of board certification candidates struggle with differentiating common anatomical variations from pathological findings on imaging. A 45-year-old male presents with chronic, mild anterior knee pain. Radiographs reveal a small, ossified structure adjacent to the medial tibial plateau. What is the most appropriate initial step in managing this patient's diagnostic dilemma? Option A. Proceed with surgical exploration to excise the ossified structure, assuming it is a loose body. Option B. Obtain a detailed patient history and perform a thorough physical examination, correlating findings with the radiographic appearance, and consider the possibility of a normal anatomical variant such as an accessory ossicle. Option C. Initiate conservative management with NSAID and physical therapy, deferring further imaging until symptoms worsen. Option D. Order a CT scan to further delineate the ossified structure and assess for signs of fracture. The correct answer is A. Proceed with surgical exploration to excise the ossified structure, assuming it is a loose body. Explanation. This scenario presents a professional challenge due to the inherent variability in human anatomy and the potential for these variations to mimic or complicate pathological conditions. A foot and ankle surgeon must possess a robust understanding of common anatomical variations and anomalies to accurately diagnose and effectively treat patients. Failure to recognize these variations can lead to misdiagnosis, delayed treatment, inappropriate surgical planning, and ultimately, suboptimal patient outcomes. The challenge lies in distinguishing between a normal anatomical variant and a true pathology, which requires a high degree of clinical acumen, knowledge of embryology, and experience. The correct approach involves a systematic evaluation that prioritizes a thorough patient history and physical examination, followed by judicious use of imaging. This approach is justified by the ethical and professional standards of the American Board of Foot and Ankle Surgery Certification Examination, which emphasizes evidence-based practice and patient safety. Specifically, the ABFAS standards implicitly require a comprehensive diagnostic process that accounts for individual patient anatomy. Recognizing a sesamoid bone variant, for instance, as distinct from a fracture, is fundamental to providing appropriate care and avoiding unnecessary interventions. This aligns with the principle of do no harm and the commitment to providing the highest quality of care. An incorrect approach would be to immediately assume a pathological process based solely on radiographic findings without considering the possibility of anatomical variation. For example, interpreting a bipartite patella as a fracture without further investigation or consideration of its common occurrence would be a diagnostic error. This failure to consider anatomical variations can lead to inappropriate treatment, such as surgical fixation of a non-pathological structure, resulting in patient harm and potential professional repercussions. Another incorrect approach is to rely solely on imaging without a thorough clinical correlation. While imaging is crucial, it must be interpreted in the context of the patient's symptoms and physical findings. Over-reliance on imaging without clinical correlation can lead to misinterpretation of incidental findings or normal anatomical variants as significant pathologies. The professional reasoning process for similar situations should involve a tiered approach to diagnosis. First, gather comprehensive clinical information. Second, consider the differential diagnoses, explicitly including common anatomical variations. Third, utilize diagnostic imaging strategically to confirm or refute suspected pathologies, always interpreting findings in light of the clinical picture and known anatomical variations. Finally, engage in continuous learning and consultation when faced with unusual presentations to ensure the most accurate diagnosis and effective treatment plan. Question 6. Performance analysis shows that a foot and ankle surgeon is evaluating a complex diabetic foot ulcer. Which of the following approaches to wound assessment best aligns with the principles of comprehensive evaluation and documentation expected for ABFAS certification? Option A. Measuring the wound's length and width, describing the visible tissue types, e.g., granulation, slough, and noting the presence and type of exudate. Option B. Relying solely on the patient's subjective report of pain and discomfort associated with the wound. Option C. Documenting only the general area of the ulcer and noting that it appears infected. Option D. Estimating the wound's depth based on visual inspection without using a calibrated probe or measuring device. The correct answer is C. Documenting only the general area of the ulcer and noting that it appears infected. Explanation. Scenario analysis. This scenario is professionally challenging because accurate and comprehensive wound assessment is foundational to effective foot and ankle surgical care. Inaccurate or incomplete assessment can lead to misdiagnosis, inappropriate treatment selection, delayed healing, increased risk of complications such as infection or further tissue damage, and ultimately, suboptimal patient outcomes. The ABFAS certification examination emphasizes the critical importance of meticulous clinical evaluation, as it directly impacts patient safety and the surgeon's ability to provide evidence-based care within the established scope of practice. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the wound, encompassing its dimensions, length, width, depth, precise anatomical location, and the characteristics of the visible tissues. This includes noting the presence and appearance of granulation tissue, slough, eschar, necrotic tissue, and any signs of infection, erythema, warmth, purulence, odor. Documenting the wound bed characteristics, exudate type and amount, and the condition of the surrounding skin is also crucial. This comprehensive assessment aligns with best practices in wound care and is directly supported by the principles of surgical evaluation emphasized by the American Board of Foot and Ankle Surgery. Such detailed documentation provides a baseline for monitoring treatment efficacy and guides subsequent clinical decisions, ensuring that care is tailored to the specific needs of the wound and the patient. This adheres to the ethical obligation of providing competent and diligent care, as expected of a certified foot and ankle surgeon. Incorrect approach is analysis, an approach that focuses solely on the wound size and location, neglecting depth and tissue characteristics, is professionally unacceptable. This failure to fully characterize the wound bed can lead to overlooking critical factors such as the extent of tissue involvement or the presence of infection, thereby compromising treatment planning. This violates the principle of providing thorough and complete patient care. An approach that only documents the presence of a wound without quantifying its dimensions or describing its tissue composition is also professionally deficient. This lack of detail renders the assessment insufficient for tracking progress or making informed therapeutic decisions, potentially leading to a deviation from best practice standards for wound management. This falls short of the diligence required in surgical practice. An approach that prioritizes subjective descriptions of wound appearance over objective measurements and tissue characterization is problematic. While subjective observations are part of a complete assessment, they should be supported by objective data. Relying solely on subjective impressions without precise measurements or detailed tissue descriptions can lead to inconsistencies in assessment and hinder effective communication among healthcare providers, potentially impacting patient care continuity and safety. This represents a failure to adhere to objective clinical standards. Professional reasoning. Professionals should approach wound assessment with a structured methodology. This involves a systematic review of the wound's dimension, depth, location, and the qualitative and quantitative characteristics of the wound bed and surrounding tissues. The process should be guided by established wound assessment tools and protocols, ensuring all relevant parameters are documented. This objective and comprehensive approach allows for accurate baseline establishment, effective monitoring of healing progress, and informed decision-making regarding treatment interventions. Professionals must continuously strive for accuracy and completeness in their assessments, to uphold the highest standards of patient care, and to meet the rigorous expectations of their specialty board certification. Question 7. Implementation of a novel topical agent for chronic non-healing diabetic foot ulcers has been proposed by a pharmaceutical representative, who claims it significantly accelerates granulation tissue formation and epithelialization. The surgeon has not encountered this agent in prior clinical practice or in the peer-reviewed literature. What is the most appropriate next step for the surgeon to take before considering its use in patient care? Option A. Proceed with using the agent based on the representative's assurances, assuming it is a standard of care product for wound healing. Option B. Request detailed clinical trial data and peer-reviewed publications from the pharmaceutical representative to independently assess the agent's efficacy and safety profile. Option C. Immediately initiate treatment with the agent on a select group of patients with chronic non-healing diabetic foot ulcers to gather personal clinical experience. Option D. Consult with other podiatric surgeons in the local area to see if they have experience with the agent and what their anecdotal results have been. The correct answer is C. Immediately initiate treatment with the agent on a select group of patients with chronic non-healing diabetic foot ulcers to gather personal clinical experience. Explanation. This scenario is professionally challenging because it requires the foot and ankle surgeon to balance the desire to optimize patient outcomes with the imperative to adhere to established evidence-based practices and regulatory guidelines for the use of novel or off-label treatments. The surgeon must critically evaluate the scientific merit of a proposed wound healing agent, considering its efficacy, safety profile, and the existing body of literature, all within the framework of responsible medical practice and potential regulatory oversight. The correct approach involves a thorough review of the available scientific literature to establish the efficacy and safety of the proposed wound healing agent. This includes seeking out peer-reviewed studies, clinical trials, and any relevant FDA approvals or indications. If the agent is investigational or being used off-label, the surgeon must ensure that the patient is fully informed of the risks, benefits, and alternatives, and that informed consent is obtained. This aligns with the ethical principles of patient autonomy and beneficence, and the regulatory expectation that medical interventions are supported by evidence and used appropriately. The American Board of Foot and Ankle Surgery Certification Examination emphasizes a commitment to evidence-based medicine and patient safety, which necessitates a rigorous evaluation of any therapeutic modality. An incorrect approach would be to adopt the proposed wound healing agent based solely on anecdotal evidence or marketing claims, without independent verification of its efficacy and safety through peer-reviewed literature. This fails to uphold the standard of care and the ethical obligation to provide treatment supported by scientific evidence. Relying on a colleague's recommendation without due diligence also represents a failure to critically appraise information, which is a cornerstone of professional medical practice. Furthermore, using an agent without understanding its regulatory status or potential off-label implications could lead to legal and ethical complications, as it may not be approved for the intended use or may carry unforeseen risks. The regulatory framework for medical practice, as tested by the ABFAS certification, mandates that practitioners base their decisions on sound scientific principles and established guidelines, not on unsubstantiated claims. The professional reasoning process for similar situations should involve a systematic approach. First, identify the clinical need and potential therapeutic option. Second, conduct a comprehensive literature search to evaluate the evidence supporting each option, paying close attention to study design, sample size, and statistical significance. Third, assess the safety profile and potential side effects of each agent. Fourth, consider the patient's individual circumstances, including comorbidities, allergies, and preferences. Fifth, engage in shared decision-making with the patient, ensuring they understand the rationale for the chosen treatment, its potential outcomes, and any associated risks. Finally, document the decision-making process thoroughly in the patient's medical record. Question 8. Which approach would be most consistent with the regulatory framework and ethical guidelines for the American Board of Foot and ankle surgery certification examination when performing a complex soft tissue reconstruction of the Achilles tendon in a diabetic patient with compromised local tissue quality. Option A. Harvesting a large allograft from a cadaveric donor, performing a direct end-to-end repair with minimal tension, and immobilizing the limb in a cast for an extended period. Option B. Using a novel bioengineered scaffold that has shown promising results in preclinical studies, combined with a percutaneous tenotomy technique, and relying on the patient's self-directed rehabilitation. Option C. Utilizing an autograft from the contralateral gastrocnemius muscle, employing a standard weave technique, and initiating aggressive early weight bearing to promote tissue vascularization. Option D. Employing a synthetic graft material with a proven track record for Achilles tendon reconstruction, utilizing a minimally invasive technique, and initiating a structured, progressive rehabilitation program. The correct answer is C. Utilizing an autograft from the contralateral gastrocnemius muscle, employing a standard weave technique, and initiating aggressive early weight bearing to promote tissue vascularization. Explanation: this scenario presents a professional challenge due to the inherent risks associated with surgical procedures and the paramount importance of patient safety and informed consent, all within the strict regulatory framework governing medical practice in the United States. The American Board of Foot and Ankle Surgery Certification Examination emphasizes adherence to established standards of care and ethical conduct. The correct approach involves a thorough preoperative assessment, meticulous surgical technique, and comprehensive postoperative management, all guided by evidence-based practice and the patient's individual needs. Specifically, for soft tissue reconstruction, this includes selecting the most appropriate graft material, autograft, allograft, or synthetic, based on the defect size, location, and patient factors, employing proven surgical techniques for tendon repair or ligament reconstruction, and ensuring adequate postoperative immobilization and rehabilitation. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives the best possible outcome while minimizing harm. Furthermore, adherence to the standards of practice established by professional organizations and regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, and the Food and Drug Administration, FDA, for implantable devices is crucial. Incorrect approaches would fail to meet these standards. For instance, utilizing an experimental or unapproved graft material without proper investigation or regulatory clearance would violate FDA regulations and compromise patient safety. Employing a surgical technique that deviates significantly from established, evidence-based methods without a clear rationale and appropriate justification would fall below the standard of care, potentially leading to suboptimal outcomes or complications. Neglecting comprehensive postoperative care, such as inadequate rehabilitation protocols or insufficient follow-up, would also be a failure to provide complete patient management, potentially jeopardizing the success of the reconstruction and violating the physician's duty of care. Professional decision-making in such situations requires a systematic approach. First, thoroughly evaluating the patient's condition and the specific reconstructive needs. Second, reviewing the available evidence and established best practices for the proposed procedure. Third, considering the risks and benefits of all available treatment options, including graft materials and surgical techniques. Fourth, engaging in a detailed discussion with the patient to obtain informed consent, ensuring they understand the procedure, potential outcomes, and risks. And finally, executing the chosen plan with meticulous attention to detail and providing comprehensive postoperative care. Question 9. The analysis reveals that a patient presents with a moderate hallux valgus deformity and expresses a strong preference for a minimally invasive osteotomy technique, citing concerns about scarring and recovery time. However, based on the patient's specific biomechanics and the degree of metatarsal deviation, you, as a board-certified foot and ankle surgeon, believe a more traditional open osteotomy with a distal soft tissue procedure offers a significantly higher likelihood of long-term correction and reduced risk of recurrence. What is the most appropriate course of action? Option A. Proceed with the patient's preferred minimally invasive osteotomy, documenting their request and your reservations. Option B. Schedule the patient for the recommended open osteotomy and distal soft tissue procedure. After a thorough discussion of the risks, benefits, and alternatives, including the rationale for why the minimally invasive approach may be suboptimal for their specific condition. Option C. Advise the patient that their preferred procedure is not medically indicated and refuse to operate, suggesting they seek a second opinion. Option D. Agree to perform the minimally invasive osteotomy as requested without further discussion to ensure patient satisfaction. The correct answer is A. Proceed with the patient's preferred minimally invasive osteotomy, documenting their request and your reservations. Explanation. This scenario presents a common challenge in surgical practice, balancing patient autonomy and informed consent with the surgeon's professional judgment and the established standards of care for a specific procedure. The challenge lies in ensuring the patient fully comprehends the risks, benefits, and alternatives, especially when the patient's request deviates from the surgeon's recommended course of action based on their expertise and the specific pathology. The surgeon must navigate this delicate balance while adhering to the ethical and legal obligations of the American Board of Foot and Ankle Surgery, ABFAS, certification standards, which implicitly require a commitment to patient safety and evidence-based practice. The correct approach involves a thorough and documented discussion with the patient, clearly outlining the surgeon's rationale for recommending a specific surgical technique for their bunion deformity. This includes explaining the expected outcomes, potential complications, and the recovery process associated with the recommended procedure. Crucially, the surgeon must also explain why the patient's preferred, less invasive technique might be suboptimal for their specific foot structure and the severity of their bunion, detailing the potential for recurrence or incomplete correction. This aligns with the ABFAS ethical guidelines that emphasize patient education and shared decision-making, ensuring that the patient's consent is truly informed. The surgeon's responsibility is to provide the patient with the necessary information to make a decision that is in their best medical interest, even if it means disagreeing with the patient's initial preference. An incorrect approach would be to proceed with the patient's requested, less invasive procedure without adequately explaining its potential limitations or the superiority of the recommended approach. This failure to fully inform the patient about the risks of suboptimal outcomes or recurrence constitutes a breach of ethical duty and potentially violates the principles of informed consent, as the patient cannot make a truly informed decision if they are not aware of the full spectrum of possibilities and risks. Another incorrect approach would be to dismiss the patient's request outright without engaging in a detailed discussion, which can be perceived as paternalistic and may erode patient trust, hindering the collaborative doctor-patient relationship essential for successful surgical outcomes. Finally, agreeing to the patient's preferred procedure solely to satisfy their request, without a clear medical justification and a thorough discussion of the potential downsides, would be ethically questionable and could expose the surgeon to liability if the outcome is poor. The professional reasoning process in such a situation should begin with a comprehensive assessment of the patient's condition and their stated desires. This should be followed by an open and honest dialogue, where the surgeon clearly articulates their medical opinion, supported by evidence and experience, regarding the most appropriate surgical intervention. The surgeon must actively listen to the patient's concerns and preferences, addressing them directly. The decision-making process should be a collaborative one, aiming for a mutually agreed-upon plan that prioritizes the patient's long-term foot health and functional recovery, while respecting their autonomy within the bounds of safe and effective medical practice. Documentation of this discussion and the final agreed-upon plan is paramount. Question 10. Market research demonstrates that patients presenting with chronic ankle instability often exhibit subtle yet significant alterations in their gait kinematics and kinetics. A 45-year-old male presents with recurrent ankle sprains and a persistent feeling of giving way during athletic activities. During a clinical assessment, you observe a noticeable decrease in ankle dorsiflexion during the terminal stance phase of gait and an increased inversion moment at heel strike. Considering the principles of foot and ankle biomechanics and the standards of practice expected for ABFAS certification, which of the following management strategies best addresses the underlying biomechanical dysfunction? Option A. Prescribe a generalized strengthening program for the lower extremity, focusing on quadriceps and hamstring muscles. Option B. Initiate a course of oral anti-inflammatory medication to manage any residual inflammation. Option C. Advise the patient to avoid all high-impact activities indefinitely to prevent further injury. Option D. Recommend a custom-molded orthotic device designed to provide medial arch support and limit subtalar joint pronation during gait. The correct answer is A. Prescribe a generalized strengthening program for the lower extremity, focusing on quadriceps and hamstring muscles. Explanation: this scenario presents a professional challenge because it requires the foot and ankle surgeon to integrate complex biomechanical principles with patient-specific functional goals and the established standards of care within the American Board of Foot and Ankle Surgery (ABFAS) certification framework. The surgeon must not only understand the theoretical kinematics and kinetics of the ankle joint, but also apply this knowledge to a practical clinical problem, ensuring that their proposed management strategy is both scientifically sound and ethically defensible according to U.S. regulatory and professional guidelines. The difficulty lies in translating abstract biomechanical concepts into concrete, evidence-based treatment decisions that prioritize patient safety and optimal functional outcomes, all while adhering to the rigorous standards expected of a certified ABFAS surgeon. The correct approach involves a comprehensive assessment of the patient's gait, identifying specific kinematic deviations, e.g., altered joint angles during stance or swing phases, and inferring the underlying kinetic forces, e.g., abnormal moments or ground reaction forces, that contribute to their symptoms. This understanding then guides the selection of a treatment strategy that directly addresses these biomechanical derangements. For instance, if excessive pronation is identified, leading to abnormal tibial rotation and increased medial ankle stress, the treatment might focus on orthotic interventions designed to control subtalar joint motion and improve overall lower extremity alignment. This approach is justified by the ABFAS emphasis on evidence-based practice and the fundamental principle of treating the underlying pathology, which in this context is rooted in biomechanical dysfunction. The surgeon's responsibility is to demonstrate a mastery of these principles and their application to patient care, as evaluated during the certification process. An incorrect approach would be to rely solely on subjective patient complaints without a thorough biomechanical analysis. For example, if the surgeon were to prescribe a generic exercise program without understanding the specific joint angles or forces contributing to the patient's pain, they would be failing to address the root cause of the problem. This could lead to ineffective treatment, prolonged recovery, and potential worsening of the condition, which is contrary to the ABFAS commitment to high-quality patient care and the ethical obligation to provide appropriate and effective treatment. Another incorrect approach would be to recommend a surgical intervention based on anecdotal evidence or personal preference, without a clear biomechanical rationale supported by the patient's specific presentation and established surgical indications. This would violate the principle of informed consent and could expose the patient to unnecessary risks, falling short of the professional standards expected of ABFAS-certified surgeons. The professional decision-making process for similar situations should involve a systematic evaluation. First, conduct a thorough history and physical examination, paying close attention to the patient's functional limitations and pain patterns. Second, perform a detailed biomechanical assessment, including gait analysis, to identify specific kinematic and kinetic abnormalities. Third, correlate these findings with the patient's symptoms and functional goals. Fourth, develop a treatment plan that directly addresses the identified biomechanical issues, utilizing evidence-based interventions. Finally, document the assessment, rationale for treatment, and expected outcomes meticulously, ensuring clear communication with the patient throughout the process. This structured approach ensures that decisions are grounded in sound scientific principles and ethical considerations, aligning with the expectations of the ABFAS. Question 11. The evaluation methodology shows a candidate presenting a case of a 35-year-old recreational runner who experienced an acute, audible pop in their left ankle during a soccer match, followed by immediate pain and inability to bear weight. The candidate's initial assessment includes palpation of the lateral ankle, assessment of anterior drawer and talar tilt, and observation of ecchymosis. The candidate has ordered plain radiographs of the ankle. Which of the following diagnostic and management approaches best reflects the expected standard of care for this presentation, aligning with the principles assessed in the American Board of Foot and Ankle Surgery Certification Examination? Option A. Interpret the plain radiographs to rule out bony pathology, and then initiate a conservative treatment protocol including rest, ice, compression, and elevation, RICE, followed by gradual weight-bearing and physical therapy, Option B. Proceed directly to surgical repair of the suspected Achilles tendon rupture based on the mechanism of injury and audible pop, without further imaging. Option C. Based on the history of an audible pop and inability to bear weight, assume an Achilles tendon rupture and initiate a non-weight-bearing cast for 6 weeks, followed by aggressive physical therapy. Option D. Order an MRI of the ankle to definitively diagnose the extent of soft tissue injury, including the Achilles tendon and lateral ligaments, before initiating any treatment. The correct answer is B. Proceed directly to surgical repair of the suspected Achilles tendon rupture based on the mechanism of injury and audible pop, without further imaging. Explanation. The evaluation methodology shows a candidate presenting for board certification, demonstrating their competence in diagnosing and managing sports-related foot and ankle injuries. The professional challenge lies in the inherent variability of clinical presentations, the need for accurate diagnostic interpretation, and the application of evidence-based treatment and rehabilitation protocols within the scope of practice defined by the American Board of Foot and Ankle Surgery, ABFAS. This scenario requires a deep understanding of biomechanics, pathology, and surgical/non-surgical interventions, all while adhering to the ethical principles of patient care and professional responsibility. The correct approach involves a systematic and comprehensive evaluation of the patient's injury, integrating history, physical examination, and appropriate diagnostic imaging to arrive at an accurate diagnosis. This is followed by the development of a tailored treatment plan that prioritizes conservative management when indicated and surgical intervention when necessary, always with the goal of restoring function and preventing recurrence. The ABFAS certification examination implicitly requires candidates to demonstrate mastery of these principles, reflecting the regulatory framework that governs the practice of foot and ankle surgery in the United States. This includes adherence to established clinical guidelines and ethical standards of care, ensuring patient safety and optimal outcomes. An incorrect approach would be to rely solely on a single diagnostic modality without considering the full clinical picture, potentially leading to misdiagnosis and inappropriate treatment. For instance, a reliance on imaging alone without a thorough history and physical examination can overlook crucial clinical findings. Another failure would be to prematurely recommend surgical intervention for an injury that has a high likelihood of successful conservative management, violating the principle of least invasive effective treatment and potentially exposing the patient to unnecessary risks and costs. Furthermore, neglecting to incorporate a structured, progressive rehabilitation plan post-treatment, whether surgical or non-surgical, represents a failure to provide comprehensive care and optimize functional recovery, which is a core expectation for board-certified specialists. The professional decision-making process for similar situations should involve a structured approach. First, gather all relevant patient information: history, symptoms, mechanism of injury. Second, perform a thorough physical examination, assessing range of motion, stability, and palpating for tenderness. Third, judiciously select diagnostic imaging, X-ray, MRI, ultrasound to confirm or refine the diagnosis. Fourth, formulate a differential diagnosis and arrive at the most probable diagnosis. Fifth, develop a treatment plan, considering conservative options first, and then surgical options if conservative measures fail or are clearly indicated. Sixth, establish a clear, evidence-based rehabilitation protocol tailored to the specific injury and patient's goals. Finally, maintain open communication with the patient regarding diagnosis, treatment options, risks, benefits, and expected outcomes. Question 12. Strategic planning requires a foot and ankle surgeon to meticulously evaluate a patient presenting with a complex calcaneal fracture sustained from a fall. The surgeon has identified multiple fracture fragments and significant articular involvement. Considering the ABFAS certification examination's emphasis on evidence-based practice and patient-centered care, which of the following approaches best reflects the required professional judgment and adherence to regulatory frameworks? Option A. Recommend a specific surgical technique based on the surgeon's personal experience and preference, without extensively detailing alternative treatment options to the patient. Option B. Discuss with the patient the potential benefits and risks of both non-operative management and surgical intervention, including ORIF and subtalar arthroses, based on the specific fracture pattern and patient factors, to collaboratively determine the most appropriate treatment plan. Option C. Immediately schedule the patient for ORIF, as complex calcaneal fractures generally require surgical intervention for optimal outcomes. Option D. Proceed with conservative management, including casting and non-weight bearing, as surgical intervention for calcaneal fractures often leads to poor long-term functional results. The correct answer is C. Immediately schedule the patient for ORIF, as complex calcaneal fractures generally require surgical intervention for optimal outcomes. Explanation: this scenario presents a common implementation challenge in foot and ankle surgery, balancing immediate patient needs with the long-term implications of surgical decision-making, particularly in the context of trauma. The challenge lies in the inherent uncertainty of fracture healing, the potential for complications, and the need to adhere to established surgical principles and best practices, all while navigating the ethical imperative to provide the best possible care. The American Board of Foot and Ankle Surgery, ABFAS, certification examination emphasizes not only technical proficiency, but also the surgeon's ability to apply sound clinical judgment and adhere to professional standards. The correct approach involves a comprehensive assessment of the fracture, including mechanism of injury, displacement, comminution, and involvement of articular surfaces, followed by a discussion with the patient regarding all viable treatment options, including their respective risks, benefits, and expected outcomes. This aligns with the ABFAS emphasis on evidence-based practice and patient-centered care. Specifically, the ABFAS expects surgeons to demonstrate a thorough understanding of fracture classification systems e.g., AO/OTA for lower extremity fractures, and to select treatment modalities that are supported by current literature and clinical consensus. The ethical obligation to obtain informed consent, which necessitates a clear explanation of treatment alternatives and potential complications, is paramount. This approach ensures that the patient is an active participant in their care, and that the chosen treatment plan is both medically appropriate and aligned with the patient's goals and values. An incorrect approach would be to proceed with a specific surgical technique without adequately considering alternative conservative management options, or without a thorough discussion of the risks and benefits with the patient. This could lead to suboptimal outcomes and potential patient dissatisfaction. Ethically, this fails to uphold the principle of beneficence and non-maleficence by potentially exposing the patient to unnecessary surgical risks without fully exploring less invasive alternatives. Furthermore, it violates the principle of patient autonomy by not providing sufficient information for informed consent. Another incorrect approach would be to solely rely on the patient's initial preference for surgery without a detailed explanation of the potential downsides or the feasibility of non-operative management. This bypasses the surgeon's professional responsibility to guide the patient towards the most appropriate treatment based on their clinical presentation and the available evidence. This failure to provide comprehensive counseling can lead to unrealistic expectations and a breakdown in the patient-physician relationship. Finally, an incorrect approach would be to choose a surgical technique based on personal preference or familiarity rather than on the specific characteristics of the fracture and the patient's overall condition. This deviates from the ABFAS standard of care, which mandates that treatment decisions be evidence-based and tailored to the individual patient. Such a decision-making process can result in the selection of a suboptimal surgical intervention, potentially leading to complications and the need for revision surgery. The professional reasoning process in such situations should begin with a thorough diagnostic workup, including appropriate imaging. This is followed by a systematic evaluation of the fracture according to established classification systems. Next, all potential treatment options, both conservative and surgical, should be considered, weighing their respective risks, benefits, and likelihood of success. A detailed discussion with the patient, ensuring they understand all aspects of the proposed treatment, is crucial for obtaining informed consent. The final decision should be a shared one, reflecting both the surgeon's expertise and the patient's preferences and goals. Question 13. The control framework reveals that a patient presents with a painful, symptomatic plantar wart that has been resistant to over-the-counter treatments. The patient has researched online and is adamant about undergoing a specific, experimental ablative laser therapy that is not yet widely recognized or approved by major regulatory bodies for this indication, citing anecdotal evidence of rapid resolution. The surgeon has concerns about the efficacy, potential for scarring, and lack of long-term data for this particular laser therapy in treating plantar warts, and believes a more established treatment, such as cryotherapy or salicylic acid, would be more appropriate and safer? What is the most ethically and professionally sound approach for the foot and ankle surgeon in this situation? Option A. Proceed with the experimental laser therapy as requested by the patient, assuming that patient autonomy supersedes the surgeon's professional judgment regarding established treatment protocols. Option B. Engage in a detailed discussion with the patient about their concerns and desire for the experimental laser therapy. Thoroughly explain the risks, benefits, and uncertainties associated with both the experimental laser therapy and established treatments, and collaboratively develop a treatment plan based on shared decision-making, documenting the discussion and the rationale for the chosen course of action. Option C. Recommend the experimental laser therapy without further discussion, as the patient has expressed a clear preference and the surgeon is obligated to fulfill patient requests. Option D. Firmly refuse to consider the experimental laser therapy and insist that the patient undergo cryotherapy or salicylic acid treatment, as these are the only acceptable options according to standard practice. The correct answer is B. Engage in a detailed discussion with the patient about their concerns and desire for the experimental laser therapy. Thoroughly explain the risks, benefits, and uncertainties associated with both the experimental laser therapy and established treatments, and collaboratively develop a treatment plan based on shared decision-making, documenting the discussion and the rationale for the chosen course of action. Explanation. The control framework reveals a scenario that is professionally challenging due to the inherent conflict between a patient's expressed desire for a specific treatment and the surgeon's ethical and professional obligation to provide care that is medically appropriate and evidence-based. The surgeon must navigate the patient's autonomy while upholding their duty of care, ensuring informed consent, and adhering to professional standards. This requires careful judgment to balance patient wishes with the surgeon's expertise and the best interests of the patient's health. The correct approach involves a thorough discussion with the patient, exploring the rationale behind their request, educating them on alternative, evidence-based treatments, and clearly articulating the risks and benefits of each option, including the proposed treatment and medically indicated alternatives. This approach upholds the principle of informed consent, a cornerstone of ethical medical practice, ensuring the patient can make a decision based on complete and accurate information. It aligns with the American Board of Foot and Ankle Surgery's commitment to patient safety and competent practice, which implicitly requires adherence to established medical guidelines and ethical principles. An incorrect approach would be to immediately accede to the patient's request without a comprehensive discussion. This fails to uphold the surgeon's duty to provide medically appropriate care and could lead to suboptimal outcomes or harm. It also undermines the informed consent process by not fully exploring the patient's understanding or presenting all viable options. Ethically, this could be construed as practicing below the standard of care. Another incorrect approach would be to dismiss the patient's request outright without attempting to understand their perspective or educate them on alternatives. This demonstrates a lack of respect for patient autonomy and can damage the patient-physician relationship. It also fails to fulfill the obligation to provide comprehensive patient education, which is essential for shared decision-making. A third incorrect approach would be to proceed with the requested treatment while withholding information about more effective or less risky alternatives. This constitutes a breach of the duty of candor and honesty, fundamental ethical principles in medicine. It also violates the spirit of informed consent by not providing the patient with all necessary information to make a truly autonomous decision. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the patient's concerns and desires. Second, assess the medical appropriateness of the patient's request based on current evidence-based guidelines and the patient's specific condition. Third, engage in a detailed discussion about all available treatment options, including the patient's preferred method, medically indicated alternatives, and the risks, benefits, and expected outcomes of each. Fourth, ensure the patient fully comprehends the information provided and can articulate their understanding. Finally, collaboratively arrive at a treatment plan that respects patient autonomy while prioritizing their health and well-being. Documenting this process thoroughly. Question 14. Consider a scenario where a patient with a complex pes planus deformity involving significant talonavicular and calcaneocuboid joint instability requests a specific surgical correction that the foot and ankle surgeon believes, based on anatomical principles and clinical experience, is unlikely to provide optimal long-term functional restoration and carries a higher risk of recurrence compared to a more comprehensive reconstructive approach. The patient is adamant about their preferred procedure, citing anecdotal evidence from a friend. The surgeon has thoroughly explained the anatomy of the foot and ankle, including the biomechanical implications of the deformity and the proposed surgical options. Which of the following represents the most ethically and professionally sound approach for the surgeon to take? Option A. Engage in a further, detailed discussion with the patient, exploring their understanding of the risks and benefits of both the requested procedure and the surgeon's recommended approach, potentially involving a second opinion, to reach a mutually agreeable plan that respects the patient's autonomy while upholding the surgeon's professional judgment and duty of care. Option B. Insist on performing the more comprehensive reconstructive approach, explaining that it is the only acceptable option for optimal outcomes, and proceed without further negotiation. Option C. Proceed with the patient's requested surgical procedure, prioritizing patient autonomy above all else, and document the patient's informed consent. Option D. Decline to operate and refer the patient to another surgeon who may be more willing to perform the requested procedure, without further discussion or explanation of the surgeon's concerns. The correct answer is C. Proceed with the patient's requested surgical procedure, prioritizing patient autonomy above all else, and document the patient's informed consent. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the surgeon's clinical judgment regarding the optimal treatment plan, particularly when it involves complex anatomical structures and potential long-term functional outcomes. The surgeon must navigate this ethical dilemma while adhering strictly to the standards of care and ethical guidelines governing the practice of foot and ankle surgery within the United States, as mandated by the American Board of Foot and Ankle Surgery Certification Examination. The correct approach involves a thorough and documented discussion with the patient, exploring their understanding of the proposed procedure, the risks and benefits, and alternative treatment options. This approach prioritizes informed consent, a cornerstone of medical ethics and U.S. regulatory frameworks. Specifically, it aligns with the principles of patient autonomy and beneficence, ensuring the patient can make a decision based on complete and accurate information. The surgeon's responsibility is to provide clear, understandable explanations of the anatomical implications, the surgical risks, and the expected functional recovery, thereby empowering the patient to participate actively in their care. Documenting this discussion is crucial for legal and ethical accountability, demonstrating that the patient's decision was made with full knowledge. An incorrect approach would be to proceed with the patient's preferred, but clinically suboptimal, surgical plan without adequately addressing the surgeon's concerns. This would represent a failure to uphold the duty of care, potentially leading to a worse functional outcome for the patient and violating the principle of non-maleficence. It also undermines the surgeon's professional responsibility to provide the best possible medical advice. Another incorrect approach would be to dismiss the patient's concerns or preferences outright and unilaterally decide on the surgical course without further dialogue. This disregards patient autonomy and can erode trust, creating a paternalistic dynamic that is ethically unsound and contrary to modern patient-centered care principles. Such an approach fails to acknowledge the patient's right to be involved in decisions about their own body. A further incorrect approach would be to proceed with the surgery as requested by the patient, without fully exploring the anatomical nuances and potential long-term consequences of the chosen technique, especially if it deviates significantly from standard practice for the identified pathology. This could lead to unforeseen complications or suboptimal results, reflecting a lack of due diligence in surgical planning and execution. The professional decision-making process in such situations requires a systematic approach. First, thoroughly assess the patient's condition and the anatomical considerations. Second, clearly articulate the recommended treatment plan, including the rationale based on established surgical principles and anatomical knowledge. Third, engage in open and honest communication with the patient, actively listening to their concerns and addressing their questions. Fourth, explore all reasonable alternatives and their respective risks and benefits. Finally, document the entire process, ensuring that informed consent is obtained for the chosen course of action, which may involve shared decision-making or, In rare cases where a significant ethical or safety concern remains, referral to another qualified surgeon. Question 15. Cost-benefit analysis shows that ordering an MRI for a patient presenting with mild ankle pain and swelling, with no history of trauma or significant functional limitation, may lead to the identification of incidental findings that could necessitate further, costly investigations and treatments. As a foot and ankle surgeon certified by the IBFAS, how should you proceed with the interpretation of the MRI scan, considering the ethical imperative to provide appropriate care while being mindful of healthcare resource utilization? Option A. Advise the patient that the MRI was likely unnecessary given the mild symptoms, and suggest they avoid reviewing the detailed findings to prevent unnecessary anxiety and further medical interventions. Option B. Interpret the MRI focusing solely on findings directly related to the patient's mild ankle pain and swelling, and if no significant pathology is identified in that specific area, conclude the MRI was not clinically indicated, and inform the patient of the cost-benefit outcome. Option C. Interpret the MRI with a primary focus on the suspected soft tissue injury, but also critically evaluate any incidental findings for their potential clinical relevance to the patient's overall health, and discuss these findings and their implications with the patient to guide further management decisions. Option D. Interpret the MRI comprehensively, correlating all findings with the patient's clinical presentation, and if incidental findings are identified that could have future clinical significance, recommend further diagnostic workup and management accordingly, regardless of the initial presenting complaint. The correct answer is B. Interpret the MRI focusing solely on findings directly related to the patient's mild ankle pain and swelling, and if no significant pathology is identified in that specific area, conclude the MRI was not clinically indicated, and inform the patient of the cost-benefit outcome. Explanation. This scenario presents a professional challenge because it requires a foot and ankle surgeon to balance the immediate need for diagnostic information with the ethical and regulatory obligations concerning patient care and resource utilization. The surgeon must interpret an MRI scan for a patient with a suspected soft tissue injury, but the cost of the MRI and the potential for incidental findings that may or may not be clinically significant create an ethical dilemma. The core of the challenge lies in ensuring that diagnostic imaging is both medically necessary and ethically justified, adhering to the principles of prudent medical practice and patient welfare as guided by the American Board of Foot and Ankle Surgery, IBFAS, certification standards, which implicitly endorse evidence-based medicine and responsible healthcare resource management. The correct approach involves a thorough clinical assessment to determine the necessity of the MRI and a careful interpretation of the scan, focusing on findings directly relevant to the patient's presenting symptoms and suspected diagnosis. This approach is ethically and professionally sound because it prioritizes patient well-being by obtaining necessary diagnostic information while avoiding unnecessary costs and potential patient anxiety from incidental findings. It aligns with the IBFAS implicit expectation of evidence-based practice, where diagnostic tools are employed judiciously based on clinical indication. Furthermore, it reflects a commitment to responsible stewardship of healthcare resources, a principle that underpins professional medical practice. An incorrect approach would be to order an MRI without a clear clinical indication, relying solely on the patient's request or a vague suspicion of injury. This is ethically problematic as it deviates from the principle of medical necessity, potentially leading to unnecessary patient exposure to imaging radiation. Though MRI is non-ionizing, it still involves time and potential for claustrophobia or contrast reactions, and incurring costs that are not justified by the clinical benefit. It also risks generating incidental findings that could lead to further, potentially unnecessary, investigations and treatments, increasing patient burden and healthcare expenditure without a clear benefit. Another incorrect approach would be to dismiss significant findings on the MRI that are outside the immediate scope of the initial complaint without further consideration. The focus should be on the presenting problem. A responsible interpretation requires acknowledging and evaluating all significant findings, even if they are incidental, to determine their potential clinical relevance and impact on the patient's overall health. Failing to do so could represent a breach of professional duty to provide comprehensive care and could lead to delayed diagnosis of other conditions. A third incorrect approach would be to interpret the MRI in isolation, without correlating the findings with the patient's clinical presentation. The MRI is a diagnostic tool, not a definitive diagnosis in itself. A thorough interpretation requires integrating the imaging findings with the patient's history, physical examination, and other relevant clinical data to arrive at an accurate diagnosis and treatment plan. Relying solely on the MRI report without clinical correlation can lead to misdiagnosis and inappropriate management. The professional decision-making process for such situations should involve a systematic approach. 1. Thorough clinical evaluation. Gather a detailed patient history and perform a comprehensive physical examination to establish a clear differential diagnosis and identify specific clinical questions that imaging might answer. 2. Assessment of diagnostic necessity. Determine if an MRI is the most appropriate diagnostic tool to answer the clinical questions and if the potential benefits outweigh the risks and costs. 3. Judicious ordering of imaging. If an MRI is deemed necessary, ensure the order is specific and targets the suspected pathology. 4. Comprehensive interpretation. Correlate MRI findings with the clinical presentation, considering all significant findings, both expected and unexpected. 5. Patient communication and shared decision-making. Discuss the findings, their implications, and the proposed treatment plan with the patient, ensuring they understand the rationale for diagnostic and therapeutic interventions. Question 16. Operational review demonstrates a patient presenting with a palpable, firm, non-tender soft tissue mass on the plantar aspect of the foot, measuring approximately 2 cm. The mass has been present for 3 months and has shown no significant change in size. What is the most appropriate initial management strategy? Option A. Refer the patient directly to an oncologist for further evaluation and management. Option B. Perform a wide local excision of the mass with primary closure. Option C. Recommend continued observation of the mass without further intervention. Option D. Obtain a core needle biopsy or excisional biopsy for definitive histological diagnosis, followed by discussion of treatment options based on the pathology results. The correct answer is B. Perform a wide local excision of the mass with primary closure. Explanation. Scenario analysis. This scenario presents a professionally challenging situation involving a patient with a newly diagnosed soft tissue mass. The challenge lies in navigating the diagnostic and treatment pathway for a potentially malignant lesion while adhering to established best practices and regulatory guidelines for patient care and informed consent. The surgeon must balance the need for timely and accurate diagnosis with the potential for patient anxiety and the ethical imperative to involve the patient in decision-making. The complexity arises from the need to integrate clinical findings, imaging, pathology, and surgical planning within the framework of established surgical standards and patient autonomy. Correct approach analysis. The correct approach involves a systematic and evidence-based strategy that prioritizes accurate diagnosis and patient involvement. This begins with a thorough clinical evaluation and appropriate imaging to characterize the mass. Following this, a biopsy is crucial for definitive histological diagnosis, which will guide subsequent management. The surgeon has an ethical and regulatory obligation to discuss all diagnostic and treatment options with the patient, including the risks, benefits, and alternatives, ensuring informed consent is obtained before any invasive procedure. This aligns with the principles of patient-centered care and the legal requirements for medical practice, emphasizing the surgeon's role as a trusted advisor and facilitator of informed decision-making. The American Board of Foot and Ankle Surgery Certification Examination expects candidates to demonstrate a comprehensive understanding of the diagnostic workup and treatment planning for oncologic conditions, including the importance of multidisciplinary input when indicated. Incorrect approaches analysis. Proceeding directly to wide surgical excision without a definitive histological diagnosis is an incorrect approach. This bypasses a critical diagnostic step, potentially leading to inappropriate treatment, unnecessary morbidity, and failure to adequately address a malignant lesion. It violates the principle of obtaining a diagnosis before definitive treatment and could be considered a deviation from standard of care, potentially leading to adverse patient outcomes and ethical breaches related to patient safety and informed consent. Recommending immediate referral to an oncologist without first obtaining a biopsy and establishing a preliminary diagnosis is also an incorrect approach in this initial phase. While multidisciplinary care is essential for complex oncologic cases, the primary treating surgeon is responsible for the initial diagnostic workup. Premature referral without sufficient diagnostic information can delay definitive management and may not be the most efficient use of patient resources or specialist time. Opting for observation alone without further investigation, based solely on initial clinical impression, is an incorrect approach when a palpable mass is present. This neglects the potential for malignancy and the need for timely diagnosis and intervention, which could lead to disease progression and poorer prognosis. It fails to meet the standard of care for evaluating new masses and disregards the potential for serious underlying pathology. Professional reasoning. Professionals faced with a palpable soft tissue mass should adopt a structured approach. This involves a comprehensive history and physical examination, followed by appropriate imaging modalities to assess the lesion's characteristics. The next critical step is obtaining a tissue diagnosis through biopsy. Once a diagnosis is established, the surgeon must engage in a thorough discussion with the patient regarding all available treatment options, including surgical, medical, and observational pathways, along with their associated risks and benefits. This process ensures that treatment decisions are collaborative, informed, and aligned with the patient's values and preferences, while adhering to the highest standards of medical practice and ethical conduct. Question 17. Quality control measures reveal that in a recent consultation for a patient presenting with symptomatic hallux valgus and multiple hammer toes, a foot and ankle surgeon presented surgical correction as the only viable treatment option, emphasizing the immediate aesthetic improvement and downplaying the potential for non-surgical management and the risks associated with the proposed procedure. The patient, feeling pressured, agreed to surgery. Which of the following approaches best reflects the ethical and professional obligations of the surgeon in this scenario, adhering to the standards expected for ABFAS certification? Option A. The surgeon was justified in recommending surgery as the primary solution, given the patient's symptomatic presentation and the surgeon's expertise in surgical correction. Option B. The surgeon should have focused solely on the surgical procedure, as the patient sought treatment for deformities that are commonly addressed surgically. Option C. The surgeon should have provided a balanced discussion of all medically appropriate treatment options, including non-surgical interventions and various surgical techniques, detailing the risks, benefits, and expected outcomes for each, allowing the patient to make an informed decision. Option D. The surgeon should have deferred the decision to the patient's family, as they are often more invested in the patient's long-term well-being. The correct answer is C. The surgeon should have provided a balanced discussion of all medically appropriate treatment options, including non-surgical interventions and various surgical techniques, detailing the risks, benefits, and expected outcomes for each, allowing the patient to make an informed decision. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to provide accurate and unbiased information to patients regarding treatment options, particularly when those options involve surgical intervention for deformities. The core of the challenge lies in balancing the physician's expertise and experience with the patient's autonomy and right to informed consent, while adhering to professional standards of care and ethical guidelines. The physician must navigate potential conflicts of interest, ensure patient understanding, and avoid undue influence or coercion. The correct approach involves a thorough and objective discussion of all medically appropriate treatment options for the patient's hallux valgus and hammer toes, including non-surgical management and various surgical techniques. This discussion must be tailored to the individual patient's needs, lifestyle, and expectations, providing clear explanations of risks, benefits, and expected outcomes for each option. The physician should present surgical interventions as one part of a comprehensive treatment plan, not as the sole or inevitable solution. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their own care. Furthermore, it adheres to the American Board of Foot and Ankle Surgery, ABFAS certification standards, which emphasize a commitment to patient well-being and the provision of evidence-based care. The physician's role is to educate and guide, empowering the patient to make an informed choice. An incorrect approach would be to strongly advocate for a specific surgical procedure, particularly one that the physician has a vested interest in performing or one that is more complex or costly, without clear medical justification. This could involve downplaying non-surgical alternatives or presenting surgical outcomes in an overly optimistic or exaggerated manner. Such behavior violates the ethical principle of non-maleficence, avoiding harm, by potentially leading the patient to undergo unnecessary or inappropriate surgery. It also undermines patient autonomy by failing to provide a balanced perspective, thereby compromising the informed consent process. This could also be seen as a failure to uphold the ABFAS standards of professional conduct, which require honesty and transparency in patient interactions. Another incorrect approach would be to dismiss the patient's concerns about their deformities and fail to offer a comprehensive diagnostic evaluation. This could involve a perfunctory examination and a quick recommendation for surgery without adequately exploring the etiology, severity, and impact of the deformities on the patient's quality of life. This neglects the physician's duty to thoroughly diagnose and treat, potentially leading to suboptimal outcomes or overlooking underlying issues. It also fails to respect the patient's subjective experience and their right to have their concerns addressed. A third incorrect approach would be to present surgical options without adequately discussing the recovery process, potential complications, or long-term management. This incomplete disclosure prevents the patient from making a truly informed decision, as they may not fully grasp the implications of undergoing surgery. It also fails to meet the standard of care for providing comprehensive patient education, which is crucial for successful surgical outcomes and patient satisfaction. The professional reasoning process for such situations should involve a systematic approach. 1. Thorough patient assessment. Understand the patient's symptoms, functional limitations, medical history, and personal goals. 2. Comprehensive diagnosis. Accurately identify the specific deformities and their underlying causes. 3. Exploration of all treatment modalities. Discuss non-surgical options, e.g., orthotics, physical therapy, activity modification, and surgical interventions, detailing the pros and cons of each. 4. Patient-centered discussion. Tailor the information to the patient's level of understanding and address their specific concerns and questions. 5. Informed consent. Ensure the patient fully comprehends the chosen treatment plan, including risks, benefits, alternatives, and expected outcomes before proceeding. 6. Documentation. Meticulously record the patient's presentation, the discussion of treatment options, and the informed consent process. Question 18. Governance review demonstrates a concerning trend of inconsistent adherence to established hand hygiene protocols and sterile technique during minor surgical procedures within the podiatric surgery department. What is the most effective and ethically sound approach to address this systemic issue and optimize infection control practices? Option A. Immediately issue written warnings to all staff members identified as having the most recent documented lapses in protocol, emphasizing the potential for further disciplinary action if noncompliance continues. Option B. Rely primarily on patient feedback and complaints to identify specific instances of protocol deviation and address individual cases as they arise through direct conversation with the involved staff member. Option C. Schedule a single, mandatory all-staff in-service training session covering basic infection control principles, followed by a departmental memo reminding everyone of their professional obligations. Option D. Implement a comprehensive, multimodal strategy including targeted staff education on current CDC guidelines, enhanced direct observation and audit of practices with constructive feedback, and the establishment of a clear reporting mechanism for observed breaches and near misses, fostering a culture of shared responsibility for infection prevention. The correct answer is D. Implement a comprehensive, multimodal strategy including targeted staff education on current CDC guidelines, enhanced direct observation and audit of practices with constructive feedback, and the establishment of a clear reporting mechanism for observed breaches and near misses, fostering a culture of shared responsibility for infection prevention. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings, ensuring consistent adherence to infection control protocols across a busy practice. The professional challenge lies in balancing the need for efficient patient care with the absolute imperative of preventing healthcare-associated infections. Failure to maintain rigorous infection control standards can lead to patient harm, increased healthcare costs, and damage to the practice's reputation. The governance review highlights a systemic issue that requires a proactive and evidence-based solution, not just a reactive fix. Correct approach analysis. The correct approach involves a multifaceted strategy that includes reinforcing existing protocols through targeted education, implementing enhanced monitoring systems, and fostering a culture of accountability. This aligns with the core principles of infection control, as mandated by regulatory bodies overseeing medical practice in the United States, such as the Centers for Disease Control and Prevention, CDC, guidelines, and the Occupational Safety and Health Administration, OSHA, standards. Specifically, the emphasis on regular staff training on hand hygiene, sterile techniques, and environmental cleaning directly addresses known transmission routes for pathogens. Implementing a system for regular audits and feedback provides objective data to identify ongoing compliance issues and allows for timely corrective actions. Encouraging open communication about potential breaches and near misses creates a learning environment where staff feel empowered to report concerns without fear of reprisal, which is crucial for continuous quality improvement in infection prevention. Incorrect approaches analysis, focusing solely on disciplinary action without addressing the root cause of noncompliance, is an ethically and regulatorily flawed approach. While accountability is important, punitive measures alone do not educate or support staff in understanding and implementing correct procedures. This can lead to resentment and a superficial adherence to protocols, rather than genuine understanding and commitment. Furthermore, it fails to address potential systemic issues that might be contributing to the problem, such as inadequate staffing, insufficient supplies, or unclear protocols. Implementing a single, broad retraining session without ongoing reinforcement or monitoring is also insufficient. Infection control best practices evolve, and even well-intentioned staff can lapse in their adherence over time due to workload pressures or complacency. A one-time event does not guarantee sustained behavioral change. This approach neglects the need for continuous learning and performance evaluation, which are critical for maintaining high standards of infection control. Relying solely on patient complaints to identify breaches in infection control is a reactive and inadequate strategy. While patient feedback is valuable, it is often received after an infection has occurred, negating the preventative purpose of infection control measures. Furthermore, not all breaches are reported by patients, and this method fails to proactively identify and address risks before they lead to harm. A robust infection control program requires proactive surveillance and monitoring, not just reactive responses to adverse events. Professional reasoning. Professionals in foot and ankle surgery must adopt a systematic and proactive approach to infection control. This involves understanding the principles of epidemiology, microbiology, and the specific risks associated with podiatric procedures. Decision-making should be guided by evidence-based practices, regulatory requirements, such as those from the CDC and OSHA, and ethical obligations to patient safety. When a governance review identifies issues, the professional response should be to analyze the underlying causes, develop a comprehensive plan that includes education, monitoring, and feedback, and foster a culture that prioritizes infection prevention. This approach ensures not only compliance with regulations, but also the highest standard of patient care. Question 19. Compliance review shows that a competitive long-distance runner presents with symptomatic hallux rigidus. The surgeon is considering surgical intervention. Which of the following approaches best integrates functional biomechanics into the treatment plan for this athlete? Option A. Performing a chelectomy to remove dorsal osteophytes, with post-operative instructions to limit running to short distances and avoid hills. Option B. Performing a chelectomy and osteotomy to restore joint motion, with post-operative rehabilitation focused on gradual return to running, emphasizing gait retraining to minimize impact forces on the hallux. Option C. Performing a complete first metatarsophalangeal joint arthrodesis to eliminate motion and pain, with post-operative instructions to avoid high-impact activities like running. Option D. Recommending a period of rest and oral anti-inflammatory medication, with a referral for custom orthotics designed to offload the first metatarsophalangeal joint. The correct answer is B. Performing a chelectomy and osteotomy to restore joint motion, with post-operative rehabilitation focused on gradual return to running, emphasizing gait retraining to minimize impact forces on the hallux. Explanation. This scenario presents a professional challenge because it requires the surgeon to apply advanced biomechanical principles to a patient's specific functional needs, directly impacting surgical planning and post-operative rehabilitation. The challenge lies in translating theoretical biomechanical understanding into practical, individualized patient care within the established ethical and regulatory framework governing medical practice in the United States. Careful judgment is required to ensure that the proposed treatment plan is not only biomechanically sound, but also aligns with patient goals and evidence-based practice, all while adhering to the standards set forth by the American Board of Foot and Ankle Surgery, ABFAS. The correct approach involves a comprehensive biomechanical analysis of the patient's specific activity, in this case, competitive long-distance running, and integrating this understanding with the patient's presenting pathology and functional goals. This approach is ethically and regulatorily justified by the ABFAS certification standards, which emphasize the surgeon's responsibility to possess and apply knowledge of functional biomechanics to optimize patient outcomes. This includes understanding how forces are transmitted through the foot and ankle during high-impact activities and how surgical interventions will alter these forces. The goal is to restore or improve function to a level that allows the patient to return to their desired activities safely and effectively, minimizing the risk of re-injury or long-term complications. This aligns with the ethical principle of beneficence and non-maleficence, ensuring the patient receives the best possible care while avoiding harm. An incorrect approach that focuses solely on addressing the immediate anatomical deformity without considering the functional demands of long-distance running would be professionally unacceptable. This fails to meet the ABFAS standard of applying biomechanical principles to functional activities. Ethically, it risks suboptimal patient outcomes by not preparing the foot and ankle for the stresses of running, potentially leading to recurrent pain or injury, thus violating the principle of non-maleficence. Another incorrect approach that prioritizes a technically perfect surgical correction based on static anatomical measurements, disregarding the dynamic forces experienced during running, is also flawed. While anatomical accuracy is important, it is insufficient if the resulting biomechanics are not conducive to the patient's functional goals. This approach neglects the core tenet of functional biomechanics and could lead to a foot that appears anatomically corrected but functionally impaired for running, thereby failing to achieve optimal patient benefit and potentially leading to long-term dissatisfaction or complications. A further incorrect approach that relies on generalized treatment protocols for foot and ankle pathology without specific consideration for the biomechanical demands of long-distance running would be ethically and regulatorily deficient. ABFAS certification implies a level of expertise that allows for individualized patient care based on specific functional needs. Generic protocols may not adequately address the unique stresses and potential failure points associated with high-impact activities like running, thus failing to provide the highest standard of care. The professional decision-making process for similar situations should involve a systematic evaluation. First, thoroughly assessing the patient's presenting pathology and their specific functional goals, e.g., return to running. Second, conducting a detailed biomechanical analysis of the foot and ankle during the patient's desired activity, identifying specific forces, stresses, and potential points of failure. Third, considering how various surgical and non-surgical treatment options will impact these biomechanical factors. Finally, developing a treatment plan that not only addresses the pathology, but also optimizes the biomechanics for the patient's functional demands, with clear communication to the patient regarding expected outcomes and potential limitations. Question 20. Quality control measures reveal a discrepancy between the CPT code submitted for a complex foot surgery and the details documented in the operative report. The surgeon's initial billing request indicated a specific code, but a closer examination of the operative notes suggests a different, more detailed procedure was performed. Which of the following approaches best ensures compliance and accurate billing? Option A. Bill using a more generalized CPT code to avoid potential payer scrutiny, even if a more specific code is supported by documentation. Option B. Proceed with the initially requested CPT code, assuming the surgeon's request is accurate for expediency. Option C. Rely solely on the procedure title provided by the surgeon, without detailed review of the operative notes. Option D. Review the operative report and all supporting documentation to determine the most accurate CPT code that reflects the services rendered. The correct answer is D. Review the operative report and all supporting documentation to determine the most accurate CPT code that reflects the services rendered. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing and coding, ensuring accurate documentation to support billed services. The professional challenge lies in the potential for discrepancies between the documented procedure and the billed code, which can lead to compliance issues, financial penalties, and reputational damage. The need for careful judgment arises from the responsibility to uphold ethical billing practices while ensuring appropriate reimbursement for services rendered. Correct approach analysis. The correct approach involves a thorough review of the patient's medical record, including operative reports, physician's notes, and any supporting diagnostic imaging or pathology reports to verify the accuracy of the billed current procedural terminology, CPT code. This process ensures that the code accurately reflects the services performed and is supported by objective documentation. This aligns with the American Board of Foot and Ankle Surgery, ABFAS, certification examinations' emphasis on adherence to established coding guidelines and regulatory frameworks, such as those set forth by the Centers for Medicare and Medicaid Services, CMS, and the American Medical Association, AMA, for CPT coding. Proper coding is essential for accurate reimbursement and compliance with federal healthcare regulations. Incorrect approaches analysis. Relying solely on the surgeon's initial billing request without cross-referencing the operative report is an incorrect approach. This bypasses the critical step of verifying documentation, increasing the risk of coding errors and potential fraud or abuse allegations. It fails to uphold the principle of accurate representation of services rendered, which is a cornerstone of ethical medical billing. Assuming the billed code is correct based on the procedure title alone, without reviewing the detailed operative notes, is also incorrect. Procedure titles can be broad, and the specific details within the operative report are crucial for selecting the most accurate and specific CPT code. This approach neglects the nuanced nature of coding and the importance of detailed documentation. Submitting the claim with a less specific or more generalized code to expedite the billing process, even if a more specific code is supported by documentation, is incorrect. This practice, often referred to as upcoding or downcoding depending on the intent, can lead to improper reimbursement and is a violation of coding compliance principles. It prioritizes speed over accuracy and integrity. Professional reasoning. Professionals facing such a situation should adopt a systematic approach. First, they must understand the specific CPT and ICD-10-CM coding guidelines relevant to foot and ankle surgery. Second, they should prioritize a comprehensive review of all available medical documentation to ensure a direct correlation between the documented service and the chosen code. Third, if any ambiguity exists, they should consult with the performing surgeon or a certified coding specialist to clarify the documentation and ensure the most accurate code is selected. Finally, maintaining a commitment to ongoing education in coding updates and regulatory changes is paramount to ensuring continued compliance and ethical practice.